All right, so I would like to request again for your introduction, if you can
Sure.
please do it again.
Okay, yeah, sure. Hi, my name is Tracy MIligan, and I'm the Chair and Director of Neurology at New York Medical College and Westchester Medical Center, and I'm the Program Director of the Adult Neurology Residency Program at Westchester Medical Center in Valhalla, New York.
Really nice to meet you, Dr. Milligan. Okay, so this is our podcast series for Road to Residency, and this is episode one for 2025 to 2026 math cycle. And we will be releasing this episode on our YouTube. And to start with the questions, this is our first episode. So we will be starting with some of the basic questions from Dr. Milligan. Dr. Milligan, my first question would be, what do you look in a candidate whenever you read their application? What's something that clicks you instantly that, okay, this is the candidate I want to interview, or this is something really interesting on their CV? It could be anything related to their score, or maybe some research, or anything that you personally see on CV that clicks you and makes you think that, okay, this is the candidate I want to interview.
Yeah, thank you. Thank you for the opportunity to participate in your podcast. And congratulations to everybody who's thinking about applying in neurology. It's a great field. And that's what I'm looking for in the application, is that the application reflects a sincere interest in pursuing this professionally as a specialty. And that could be in a number of different ways. So somebody may have had a long-term interest in neurology and can show even going back into high school, what that interest started that then. But sometimes people don't know. They know they want to be a physician and they want to be involved in science and helping people, and they're not sure how to do that until much later when they're a medical student. And so I look for ways that that's clear to me, that they've been thoughtful about why they want to do this profession, that that's reflected in the application. And it's better if it also is reflected in the activities that have been pursued. So somebody who's a member of the student interest group in neurology, who's involved in making podcasts about how to obtain a neurology residency, somebody who's done research in neurosciences, somebody who has done volunteer work. Maybe it could be with children with autism or in a nursing home or with Alzheimer's or the epilepsy programs, something that reflects in their application that they have thought about this field and that they have made a commitment to pursuing this professionally. That is probably the most important thing, because scores do not reflect how good a neurologist somebody is going to be. They do not correlate with how good a resident is going to be. They correlate with how well somebody does on tests, which, is important in this field. But what I'm really looking for is that evidence of interest in neurology. Additionally, it's helpful to see what somebody has done besides being a good student. And that takes a tremendous amount of time. To do well in medical school is very time consuming. So, but what else has somebody done? Because, there's other activities, interests. I like to see that somebody is well-rounded. And if they've had leadership experiences, even if it's not within medical school, but something else, leadership, where I know that they are organized and use their time wisely and are able to accomplish goals and work well with other people. And that could be so many different activities that show that. So that's something else that I look for in the application. And then finally, the letters of recommendation are very important. And I will say that's also can be a challenge for people to know 3 or 4 letter writers who know you well enough to write a detailed letter of recommendation. But if you have that, that's wonderful. And that will make for really good letters of recommendation so that I can get to know more about a person and all of their strengths through people who know them in the letter writers.
All right, that was really, really helpful, and that's gonna be really helpful for all the listeners and students who will be applying for neurology. Okay, so on the flip side, if I ask you, are there any small things or any things that you see on CV and you instantly say, this is kind of a concern for me, or this is a red flag, or I don't want to interview such candidates, or anything that students might be mentioning on their CV without noticing or without having any knowledge of it, that this is actually not a good thing to say in personal statement or in CV?
I think that's a really good question because sometimes people will know things that are concerns on their application. And so if you're in that situation where something about your trajectory, there were some problems along the way, then you already know that and you can address that in your personal statement. So I've seen applications where people have failed courses or they failed the step exam. And it's very helpful if that is explained in the personal statement, the situation around it. And that's a good opportunity to use the personal statement. So people already know that. What would be some other things that are red flags? If everything in the application is about another specialty.
Right.
And I cannot see neurology in that application. And it could be an outstanding application, great scores, but the student interest group was something else. And the research was in another field.
Mm-hmm.
And I'm reading and I say, well, why are they applying to neurology? I can't tell. Maybe I'm just one of a few specialties they're applying to.
Mm-hmm.
I don't like that. So keep that in mind, that your application should reflect the specialty you're applying into. Now, sometimes people can't make a decision. They say, I would be happy going to a good program if it were in psychiatry or it were in neurology, because what I want to do in the end is I want to take care of people with dementia as a neuropsychiatrist. And I could get there either pathway, and I'm looking for a really good program. That's okay to be honest about that. I'm applying in both fields because this is where I want to go long term. And I really want to make sure I train someplace good that will help me. And I think I can get that either through neurology or psychiatry. It could be something else, neuro-ophthalmology. I want to be a neuro-ophthalmologist. I'm applying in ophthalmology. I'm applying in neurology because what I really want to do is neuro-ophthalmology, and I can get there either way. And I care about going to a really good program where I'll learn. So sometimes people do apply to more than one program, and it makes sense for their career interests. So I'm making that clear in the application. If your application does not make it clear that you want to go into neurology, then explain it in your personal statement.
Right. That was really, really helpful. Thank you so much for bringing light to that. Okay, so my next question would be, we hear a lot of, you already discussed it a bit as well, but we hear a lot about scores, research, leadership. How do you personally balance when evaluating these things in a candidate?
The scores are important these days because all the interviews are on video. And so that means that people can apply to 100 programs.
Absolutely right.
And so that means don't do that. Try to narrow it down. But I know people are applying to lots of programs, and that means they apply to programs that they probably will not want to go to in the end. They want to get into residency, they're worried about that, and they apply to a lot of programs. And so that means I have thousands of applications, and I cannot read through every single one of them. So programs need a way to just focus on some, and sometimes they'll use a cutoff board score. It has to be this, and you're going to pass the first round of screening. So I think it's good when programs say what that is, so you know, and you know why you didn't get offered an interview, because that's their minimum score, and an applicant didn't have that. That's important to kind of keep in mind. So the board scores For any specialty, this has been studied, they help you get the interview.
Mhm.
After that, they're not so important. So
Right.
once you have the interview, places are not going to rank you based on your board score. It's going to be everything else in your application and your interview.
Right. That makes a lot of sense. So, continuing your thing that you said regarding the interview, once you get the interview, that the whole thing depends on interview. So, once interview starts, and what qualities are you looking for in a candidate you are interviewing, and how well they can behave, how can they stand out in their interview? What are some of the tips, and what are some of the things that you would like them to not do and to do during the interview?
Mhm. Everybody gets better with interviews.
Mm-hmm.
So I notice this every year. The very first day of the interview season, people are not as good as the very last day of the interview season. So, what can you do? Practice. Practice having people interview you over video and ask you, tell me why you want to be a neurologist.
Mm-hmm.
Tell me about your research. Tell me about why you are interested in this program for your training. What are
Mm-hmm.
your long-term goals? And and people know that inside their head, but then when you've interviewed many places and you've said it out loud over and over again, it becomes more polished. And we all know that. We all know when people have their very first interview of the interview season, and they're going to be more nervous. They're not going to be able to articulate quite as well. We know it. Don't worry about it. But just as a tip, the more you practice, the better you get at it. At the same time, you don't want to be over rehearsed. You don't want to sound like you have a script that you're reading. It has to come from the heart. So knowing what you want to say, having it come from the heart, practicing that, I think those are good interview tips. Now, I'll just say you had mentioned how important the interview is. In a way, it's not so important. Some of these interviews are very short, they're very subjective. What you've done over the years and everything you have in your application is going to be what is judged. So as long as you don't do something really awful on the interview, and you're not going to do that,
Mm-hmm.
it's going to be fine.
Right.
So you just try to relax. People want to get to know you. In neurology, the interview process is all about the fit.
Right.
Just like any relationship, there's not a best person for everyone. There's your best person. And just for neurology residency, there's not a number one neurology residency. It does not exist. There is not a number one, but there's going to be several that are really good fit for you.
Right.
And so you want to get to know them, they want to get to know you. It's all about that match. So
Mm-hmm.
being able to share about yourself, the program itself will want to share about the program, highlight it. We want to advertise why we are potentially a great fit for you.
Right. And that was my second other question as well. So while you were answering the interview question, you gave us a lot of good questions as well that we can prepare for our interview. So thank you so much for that as well. Okay, so my next question would be, what do you think makes your program, Westchester, unique, both in terms of the academic training and as well as for the clinical exposure for residents that they.
Yeah, so I know I said there was no number one program, but we're number one.
Mm-hmm.
But if this is something that is of interest to, the applicant,
Mm-hmm.
we have a really wonderful mission. Our mission is to care for the people who live in this region of the country, regardless of ability to pay. And so that's our mission. We have a mission to give great clinical care. We're very involved in research, very involved in medical education and in community service. And we have very interesting patients because they come from so many different backgrounds. and they have a lot of different neurologic diseases. Our particular hospital is a referral center for the entire region of the country. We're the only academic medical center for 6,000 square miles. So if anybody in this whole region needs advanced neurologic care, we are the place they come to.
Mm-hmm.
And we have a great working environment. People get along, the residents have a great relationship with the attendings and vice versa. And that is what is one of our strengths. That's what the residents will tell me is they can text their attendings, they can stop by their office, they get mentorship. And having mentorship during training is really important. The clinical mentorship, and then if you want to do research, the research mentorship. We have a very high acuity inpatient system. We have a neurocritical care, neuro ICU unit. We have a comprehensive stroke center. We have a level 4 epilepsy center. So it's a very advanced neurologic care. At the same time, we have a very busy outpatient practice, a lot of focus on outpatient training, and many specific programs to help our residents get advanced training in either medical education, research, quality improvement, community service, socioeconomic disparities of care. We have a new global neurology interest group. And so we seek to really help our residents become the neurologists they want to be in that subspecialty area and their areas of interest and focus.
Right, that was really interesting to know that Westchester is such a good mix of both the academic and clinical sides. As that's amazing. My other question would be, how does your program? Because there are some candidates who are interested in just the general neurology and not following the fellowship, but there are some candidates who are interested in doing the fellowships. So, how does your program support residents aiming for fellowships versus those planning for just the general practice?
Yeah, that's a great question. And I hope that many people are interested in going into a general practice because in the United States, there's a shortage of general neurologists.
Right.
And it's a great job and a lot of job opportunities. That being said, 90% of neurology residents will do a fellowship. So not 100%, but 90%.
Right.
If a resident knows they don't want to do a fellowship, then we use the elective time to help map out how to use the elective time to be well prepared to go into practice immediately following residency. And we do have graduates who do that, but it's very specific mentorship around that. So I think that's the key, is the mentorship to do that.
Right. Thank you so much for answering this question so well. I think there will be just two more questions. I will be, okay, yeah. If you could give just one piece of advice to neurology applicants this year, what would it be?
So for people applying in neurology, the number of interviews you obtain will be important in matching. And so keep that in mind. I said, don't apply to way too many, but really think about the programs, making sure they're a good fit for your application, for the people who've been accepted to that residency in the past. So look at the alumni, look at the current residents, where are they from? Find out what they're looking for as best you can, and apply strategically to programs. And then, think about the people who don't match in neurology, that correlates with the number of interviews they've received. So that's something to keep in mind. The other thing I'll just as a piece of advice for people applying into neurology is have your application complete when it opens. So some programs we can filter the applications to only complete applications.
Right.
And so really focus on getting everything complete on time.
Right. That sounds amazing. There was just one more question we have been receiving from our students, and it was for those candidates who didn't match in the last cycle. What do you think is the smartest thing that they can do, or how they can evolve themselves for this math cycle, for especially for those candidates who didn't match in the previous cycle?
Mhm. So I had a candidate who did not match last year contact me and say, I would like some advice on my application. Would you be willing? I'm very open to feedback. This is what I really want to do. And I looked at the application, and there's nothing wrong with the application. It was a great application. It was just a very competitive year. And so when we put together our rank list, um, sometimes the people who are at the top of the list, we match right away, and then we don't go farther down. But sometimes not. So in a program, let's say a program who has 6 residents, maybe one year they have to go down to 18 on their list. Another year they go down to 8.
Right.
So, sometimes it just has to do with how everything comes together that particular year. So I think it's helpful if an applicant doesn't match to find out why they didn't match. Was that the situation, or was it something else? You didn't have enough research. The board score was too low. You seemed, narcissistic during the interview. That's hard to tell somebody, but, something, it wasn't clear you wanted to go into neurology, things that people can change. So
Mhm.
sometimes there is something particular. You didn't have any experience working in the United States healthcare system.
Mhm.
That if for people coming from another country, that's a concern because there are differences from one country to another. And in the United States, then we don't know. Like you're doing great in your own country. What about in the United States? Probably you'll do great, but you don't have any experience. So if that's the key, then you can spend a year doing volunteer work in the hospital or trying to get some sort of medical assistant job or scribe position, something that shows that you've integrated into the US healthcare system and it's gone well.
Perfect. Thank you so much, Dr. Milligan. These were really amazing advices. And definitely our audience, all the students and math applicants for this year and for next year is gonna be so grateful for all of these advices. So thank you so much for honestly for taking out time from your busy schedule to do this, to schedule this and all. And that was all from our side. And if you have anything, like if you wanna ask anything related to our med school or group, so yeah, you are something.
Um, I would like to share something with you because we are having an open house for our residency. So I just want to share my screen. So I'm going
Perfect.
to send you a request because on August 20th, Wednesday, August 20th, 7 p.m. Eastern Time, we're having a video residency open house. And so people can join that meeting. And here, let me just share. All right, so you should be able to see um,
Yes.
my screen. Oh, let me just share it a different way. Okay, so now you can see. So top things to know about residency programs. So what I'll be doing is just sharing with the audience, in my opinion, the top 10 things to look for as you're selecting a residency program. So anybody's welcome to attend that if they'd like to hear, if they'd like to hear more from me.
Absolutely, absolutely. We'll be joining. Is there any link to it that we can provide to our students?
So
Or
you can RSVP
right.
to this email below, and
Mm,
then you'll get a link.
perfect. That sounds amazing. Um, So yeah, that was it from our side. Thank you so much. And to all the listeners, this is me, Saida Taiba, and I'm ending this episode. And I'm really thankful to Dr. Milligan for doing this with us today. And she provided us with a lot of good advices and suggestions for the math applicants. So see you all again in the next episode. That was it for today. Thank you, everyone. Goodbye. Take care.
Thank you.
Thank you.
Good luck, everyone.
Thank you.